So it's 11 o'clock. Good morning, everyone. Welcome to the SAYAS webinar on today's topic, which is harnessing health innovations in Africa to tackle COVID-19, and just not COVID-19, but also beyond COVID-19. So we have four expert speakers. We'll go into the introduction of these speakers a little later. But before going on to the details of the topic, I would now want to request Ms. Edith to introduce us or give a brief outline of what SAYAS and ASAP is and how is it connected to this particular webinar. Over to you, Edith.
Thanks, Sudesh, and thanks to our panelists today. Thanks to those who've joined us today, and I think people will keep joining in as we carry on. So welcome all. Just a short intro about SAYAS and ASAP. So ASAP first is the Academy of Science for South Africa, and is a lead and only academy in South Africa, whose work is to, first of all, honor excellent leading scientists in the country, but also most importantly, provide evidence-based advice to government in a wide range of issues, using or utilizing the membership who are the brain trust of the organization. And so then in terms of just mentoring and ensuring that we have young voices who also are in this space, assisted in forming the Young Academy, which is SAYAS, the South African Young Academy of Science. And so similar to the Senior Academy, SAYAS seeks to also honor leading young scientists, but also then try and also use our voice to also add to evidence-based approaches in policy making. So we also have a wide range of scientists from different parts of the country. And in seeking to just share and talk about issues that are happening around us, we also invite other expert voices onto our different discussions. And today we have done we've done some very timely topic. All of us, just not just here but globally, are affected by the COVID pandemic. And we thought that how can we then lend our voices to some of the issues, some of the challenges or solutions that in our different corners and spaces we are working towards. And so then today's webinar seeks to do just that. We have an excellent panel members, and we hope that we can do the topic justice, but also listening to the voices of our attendees as well. A few housekeeping rules. We've asked just the panelists to keep their video on, so that they're not asleep or cooking in their kitchens, but are alert with us, and we appreciate that. But because of the bandwidth and connectivity, we asked all our attendees to put their video off and their voice as well. We'll use the chat function to ask questions. We ask that you direct your questions to a particular panelist, so that we can know who to direct the question at. If not, just indicate that anyone can answer. But once we have the presentations, Sudesh will open up the chat function later on for questions and answers, and just responses as well. It doesn't have to be a question. Maybe you can just be responding to something as well. So we'll open up the space on the chat function for the Q&A later on. So if you're not speaking, please mute your audio, so we can all then listen to the panelist at the time who's speaking. But thank you for joining us, and we hope to have an excellent discussion. Over to you, Sudesh.
Thank you very much, Edith. You kind of took also the pain of describing the housekeeping rules. Thank you so much for that. So before we start the formal presentations, it might only be appropriate for us to introduce all the speakers. Before that, I'm your moderator. My name is Sudesh Sivarasu. I'm an academic at the University of Cape Town, and I'm also a member of SAYAS, and I do medical devices innovation and a few other things. But my role today is to facilitate the interactions between the attendees and the panelists, and we have an excellent set of panel to present their overview of various innovations that they are involved in. So I'm going to ask the panelists to briefly do a 1-minute quick intro of their name, where they come from, and what health innovation or health technology innovation means to them. So 1 minute per panelist. Would you please introduce and tell to the larger audience what health innovation means to you? We could go by the order. Salami, please.
Thank you. I'm Salami Msimang. I'm an associate professor at the University of Cape Town. I'm an obstetrician and gynecologist. I'm also head of global surgery at UCT and president of the South African Clinician Scientist Society. And I'm also a World Economic Forum Young Scientist. Innovation to me is really about finding solutions, especially in healthcare, and looking at how to advance medicine and how to respond to challenges in society.
Thank you very much, Salami. The next speaker is Dr. Michele Mulder.
Good morning, everybody. My name is Michele Mulder. I'm a senior program manager at the Medical Research Council, South Africa. I am responsible for grants, a number of grants programs, but largely for innovation. And health innovation is what I eat, live, breathe, sleep. It's most of what I do is as part of my job at the MRC. And it's an extremely rewarding area to be involved in, and I'm hoping to share some of those experiences and what we're doing with you today on the webinar.
Thank you very much, Michele. Professor Moses Bukhari.
Yes, my name is Moses Bukhari. I am the EDCP Regional Director for Africa. EDCP is the European and Developing Countries Clinical Trials Partnership. I am based in Cape Town, and the Cape Town office is hosted by the South African Medical Research Council. So what EDCP does, it funds young scientists to progress in their career and research. I'll be talking to you about that. But we also support institutions to increase their capacity, both in infrastructure and equipment. So, and we also particularly focus on funding investigations around COVID-19.
Thank you very much, Moses. Dr. Palesa. You're on mute, Dr. Glazer.
Thanks. Good morning to you, panelists, and good morning to the attendees. My name is Alisa Glazer. I am a biomedical technologist by training, currently employed with the Africa Institute of South Africa, where I am a research specialist, and it is located within the Human Sciences Research Council. So most of the research that we do, it's within the health, science, technology, and innovation within the continent. Yeah, thanks.
Thank you very much, Dr. Glazer. So now we are moving on to the formal presentations by our panelists. So just some housekeeping rules. The presentations would be between 12 to 15 minutes maximum. And when we are close to the time, I will alert the speakers with 1 minute left alert or something like that. So if you have any questions, after every presentation, we'll have about 2 to 3 minutes if there is any urgent questions that we need to address. If not, we can put all the questions together for the final Q&A session for the entire panel to address. And when you're asking your questions, please drop in your questions in the chat section for the attendees. And if you want the entire panel to address the respond to your question, please state it as to all panel, or if it is to a specific speaker, please address or mark it attention to any one particular speaker as well. And at the end of the seminar, we would also provide you with the contact details of all the panelists here. So you would be able to continue to have discussions with them even via email, even after this session. So without further ado, I hand over the presentations space to Professor Msimang.
Right, thank you very much. Okay, so the title of my presentation is COVID-19 Response, Interventions and Innovation. And just to declare up front that this is work that we've done at UCT as global surgery and biomedical engineering. And so just to highlight, most importantly, I mean, we're all aware that COVID-19 has reshaped our world, how we do things, even though we don't know when the crisis will end, but we know that the world will look very different after this. And so it's important that we start looking at innovation and different solutions. My outline, I'm going to talk about digital technology, biomedical devices, and about telemedicine. And I'm going to give practical examples of innovations and interventions that we've come up with at UCT. And as I said, acknowledging biomedical engineering with Prof. Sudesh Sivarasu as having done some of the work that I'll present. So just taking us back to the healthcare system. You know, many of us look at the picture on the left and think about your consultation with the doctor. But, you know, as many of you would have seen and learned even during COVID, that there's a whole health system, and it's the functionality of the health system which ultimately determines what the outcomes are. And so also you have to understand the social determinants of health. And again, COVID-19 has shown us this and highlighted certain things. And so determinants of health include education, employment, food security, water security and sanitation, equity and equality and infrastructure. And when these things are not in place, then people have got worse health outcomes. And just an approach to healthcare. And so I've put this just to highlight, you know, the entire system before I go into the actual innovations, is seeing the different roles of policy, healthcare delivery, and outcomes. And whilst many of us think of healthcare delivery, the time from when you are diagnosed with the disease to when you recover, a lot of work goes into the prevention and rehabilitation. And so as universities, you know, a lot of focus is on education and research, but innovation is an important component as well that determines healthcare delivery. So moving at practical interventions that we've seen during the pandemic. So digital health is one. In fact, along the pandemic, you know, the term infodemic has also come up because there's just been so much information that has been going around. Some good, some bad, but a lot of information, an overload of information. And a lot of this has been done because of social media and the availability of digital health platforms. So digital health has been an important, has served in different functions, providing information not only to the general community, but also to healthcare workers. Education is also done through digital health platforms. Contact tracing has been one important thing, especially in many parts of the world, and now moving on into Africa. Virtual communication has played an important role, and digital biosense technology. And so in this time where you have to separate the patient from the doctor, there's been many means of using digital health for virtual consultations, and also to do certain screening tests that will avoid the patient actually going to the hospital. And so two innovations that we have been part of as Global Surgery, we created this USSD application. Initially in lockdown, what we realized is that there wasn't enough good information going out just to inform people about what COVID is. And so we ran this platform for a few weeks, which was also translated into 4 other African languages, South African languages. And the idea was for the information to reach people who do not necessarily have web applications, data, internet. Just by dialing a few numbers on their phone, they get information about COVID and they can a few answers to questions they may have had. And the value of this was that data was not required for this. Another application which we launched about 2 weeks ago in partnership with UNITA and the Global Surgery Foundation is a self-evaluation app, which is used for tracking patients who've got symptoms, or for tracking people with symptoms. This, of course, helps with controlling the spread of disease. It highlights areas with limited testing and treatment resources. It monitors in-country spread, and we also assist it by adding other South African languages. Again, it's low data and it identifies safe zones. And this is just an example. You can, it's on covid.za.com, and you can choose a language, but it's a very simple, straightforward app that we are hoping to launch also in other African countries. So moving on to biomedical engineering, and so important roles that have important places where we've looked at this is equipment, 3D printing, PPE, and devices. And I think what was good in our collaboration is bringing clinicians together with the engineers and coming up with ideas for things and solutions for clinical and practical needs. Of course, when you move into devices, you need to look at funding, specifications, regulations, and ensuring that whatever approvals are required are there. And so, I mean, you all know about PPE, the surge, and how much PPE we need at this time. And just, there's been an important need to make sure that it's not only, it's being created in South Africa as well. So some of the work the biomedical engineering team did was creating the UCT visor. The advantage of it is minimal skills are required to make it. It takes about 5 minutes to make. It can be made on site. And these have made a very big difference, and we're able to donate some of them to a hospital in Cape Town. And also we've seen other schools and places starting to ask for these and to buy these. So this is a simple innovation that potentially could save many lives by reducing the spread of COVID-19. The reusable N95 mask is work that is going on right now, and the importance of having a multi-use respirator and not just one that you throw a disposable one. And so this is important. This is being worked on right now. It can be sterilized and decontaminated. And this is just important to show the innovation that is going on and what can be done when we put our minds together to try and find solutions. This has been a very important innovation. It's called the Ubuntu booth. It's a multi-purpose sterile testing station that was created to design to ensure zero exposure between the patient and the tester. And as the numbers are increasing, especially in the Western Cape, we need a way of protecting, the healthcare workers from the patients and protecting the patients also from healthcare workers. And so this is a very practical, very helpful and a great innovation that was created by the team and is currently being used at the Groote Schuur Hospital right now. And so the last part I want to talk about is telemedicine. And so again, the importance of virtual consultations, how to improve service delivery, and finding other ways of service delivery that doesn't involve contact between the patient and the doctor, or between the patient or between the specialist unit. And I think we learned this model from Groote Schuur, the critical care team, as they have a tele ICU model that is currently being used. And this allows for a critical care specialist to provide care in another hospital, in another place. And so these are kind of the important innovations that are required at a time like this. And so just by a simple device that allows, allows two centers to connect. This was created by the eHealth group, and so we are looking at this innovation, and not just for tele-ICU, but also for connecting hospitals that do not have specialists with hospitals that have specialists. And so we'll be piloting one of these as well very soon. So in closing, I want to say COVID-19 is a global crisis. It requires innovation and scalable interventions that will reach populations while protecting healthcare workers and the most vulnerable populations. Thank you very much.
Thank you very much, Prof. Msimang. For the attendees, if you have any questions, please do drop in the chat section to Prof. Msimang. That was an excellent presentation, Professor Salami Msimang, and I was quite intrigued by your, the variety of projects that you are involved in. Right from starting with the COVID infodemic to all the way to, telemedicine and remote monitoring, etc., and your efforts with PPE. So, before we go on to the next presenter, I just wanted to ask one simple question to you about the usage of USSD platform and the impact of that, and how far has this gone on, and are you able to get any usage stats about this platform? Can you explain a little bit on that?
Yeah, so I mean, this was really at the beginning, and it was one of our first, interventions. And so, I mean, we initially just spread the word through social media, and then there was a bit of media marketing as well that went on. And so we had quite good numbers initially, and people who used it, and we got a lot of good, positive a lot of positive comments about it, because it was simple and provided, good information, not only to the educated, not only, to those who do not. We were reaching out to people that are, in quite far out, but then we found that even people with information found it quite useful. So, but we used it only for a few weeks and found that, and now that people knew more about COVID, we had to start looking at different applications. And so the important part with innovation is also knowing when to move on to the next thing. And so that was, after a few weeks, we felt it has done a lot of what we were hoping it would do. And now contact tracing is probably the most important thing at this time.
That's fantastic. I'll take one question from the attendees. So we have a question to you about your strategy for scaling up these innovations across African region, and how. And you also mentioned about 4 languages where your USSD platform is being used. Can you explain a little bit on that and your strategy for scaling, please?
Okay, so about the 4 languages, I mean, initially we started out with the languages that we, the translators we had access to. So Xhosa, Zulu, Setswana, and Sesotho, and we also Afrikaans as well. And so with each app, you wanna try have the 11 languages, but you're always limited by funding and the availability of translators. But it also highlighted something that was very important. And so we've also since translated also for some work for the People's Movement, because there's a lot of information available in healthcare, but people seldom think about translating it. And so trying to navigate around this, we found, there might be a whole market just for translating information to, important healthcare information, because it's often seldomly done. The other part about, how to make these scalable, and I'm just putting the acknowledgements to show that these are collaborations with so many people, with companies, with foundations. And so the important, and I mean, UNITA is one of them, but what I'm trying to say is when we work with groups and it's not just us on our own, I think that's what makes it scalable, because especially with the contact tracing app, it's the collaboration with, UN has got, UNITA has got, offices in South Africa, Department of Health, working with Department of Health, and it's bringing in the various stakeholders that make it scalable.
Thank you very much, Professor Msimang. You mentioned about the language translation, and I just want to redirect the attendees to an effort by the South African Young Academy of Science. There is an infographic that has been translated to most of African languages. You can look onto the SAYAS website and get access to this. How important this information that has been translated to local languages, and you can see that it makes actual ground level impact with when it is spoken in the language that people understand. there's another question in the audience, but actually that leads into our next speaker. The question is about how will SAMRC support the scale-up of some of these interventions? And it kind of is the right question to the next speaker, Dr. Michele Mulder, and who's going to talk about harnessing local innovations and innovation strengths to respond to COVID-19. And Michele, you might want to take with your presentation, and at the end of the presentation, I'm sure you would address the question that has been posed already.
Thank you very much. Can you all see the screen, the presentation?
Yes.
Yeah. Okay, so I'm going to speak very much about the response of the South African Medical Research Council to the COVID epidemic. But I'll talk about from our point of view, and I will say we, meaning MRC, but honestly, this has been a joint response. There have been a number of organizations, academic institutions, funders, government departments involved. So it is really not just an MRC response, it's really a national response. So just a quick introduction to the MRC. Our mission is really around funding and conducting responsive and relevant health research, capacity development, innovation and research translation. And we are, I would say, probably the largest local funder of health research in Africa, certainly in Southern Africa and quite possibly in Africa, with an annual revenue of around 1 billion rand, about half of that coming from government grants, and a large additional proportion coming from funding that we get in from elsewhere to on grant or for research within the MRC. So we try to invest close to around 45% of this in external grants, innovation and career awards, and spend as little as possible on corporate support and administration. So we have since March been driving and facilitating and supporting a substantial response to COVID, together, as I say, with local developers, researchers and funders. And I want to take you through some of that in relation to our core functions. So the core functions of the MRC are to conduct research, so that's in our intramural research units, to fund research, that's through various extramural research units, collaborating centers and programs, to facilitate innovation through, again, grant mechanisms, but also through our tech transfer office and something called the Global Health Innovation Accelerator, which I'll talk a little bit more about. We develop research capacity through various grants and scholarships. And then we also play what we would call a neutral national convening role. And in each of these areas, we've mounted some kind of response to COVID. So our intramural research units have launched more than 30 projects around research and surveillance on COVID. We have repurposed substantial amount of funding towards external and internal grants for research and innovation for COVID. We have facilitated and are busy supporting and driving innovations in COVID, and I'll focus on some of those. A lot of these initiatives involve HDIs and some of our career awardees. And then we're also using our convening role to bring together national initiatives and try and align and coordinate some of the work that's happening around the country on COVID. So this is really a non-exhaustive list of some of the intramural research that's happening. I just mentioned one or two. So our burden of disease unit is now getting weekly data on registration of deaths from the Department of Home Affairs, and is using that to try to get near real-time information on whether there actually is excess mortality at this time, and comparing it to similar periods over previous years to see what really the impact is on the death rates and causes of death due to COVID. And then we have a number of different research projects in the social sciences, looking at child support grants, mental health, maternal and child health, and also contributing to systematic reviews to provide the evidence needed by government to determine, what are effective screening practices, use of masks, and so on. And also, I think quite a topical area is the alcohol abuse and whether the alcohol ban should continue, and just generally providing research and policy advice on that. In terms of funding, at the beginning of March, when the epidemic really started to hit our shores, we rapidly approved and funded 3 projects focusing on surveillance, epidemiology, and immune responses. And that was around 17 million rand from our previous financial year. funds, both from the MRC and from the DSI SHIP funding. And since then, we've really had this influx of very good quality proposals from academics and companies and individuals around South Africa wanting to do research, but also develop new innovations for COVID. And this really required us to both put in place mechanisms to rapidly respond to triaging and selecting projects, but also meant that we really had to find additional funding to be able to put to these initiatives. So in terms of rapid response for selection and triaging of projects, we established the COVID Research and Innovation Advisory Committee. This is chaired by Glenda Gray, who's the CEO of the MRC, but it includes representation from around the country, including DSI, NHLS, various other academic institutions, DTI and others. And then we also have an in-house project selection committee specifically set up for COVID that we can quickly respond on the recommendations of the advisory committee and select projects for funding. And then in terms of making funding available, we have now managed to repurpose around 40 million Rand of funding from this financial year from MRC funds to contribute towards COVID projects. And we have an additional around 40 million from the DSI funding, which comes to MRC, and a small grant from TIER. So altogether, we've released around 80 million Rand for this financial year for COVID. Unfortunately, most of that is now committed already to projects. But I just quickly want to mention that none of this is at the expense of existing research programs. So we're not taking funding away from HIV, TB, other important areas. We're repurposing funds, for example, from travel, conferences that are not taking place, and also by pushing grant payments to the following financial year simply because of delays in projects. So we're looking at research priorities based on the local context, but looking also at global research priorities, for example, from WHO. And we also managed to substantially fast track our processes for reviewing projects, selecting, contracting, and actually getting money out the door as quickly as possible. And then in terms of facilitating innovation, I'm just going to focus on the diagnostics. So we've tried to both respond to the local needs of the NHLS and DOH, but also of those who are actually developing products. So when it comes to the NHLS, we have had a number of discussions with them, and what they are requiring is increased access to equipment, to reagents for diagnostics, but also increased capacity for testing. So we've got 3 initiatives which we are running in response to this. The one is an RFA on diagnostic reagents and point of care diagnostics. So we're actually looking for good projects around the country that can respond to those specific needs. We have a separate initiative on surge testing, and I'll go into these 2 in a little bit more detail. And then we also are managing a grant on behalf of the NHLS to access additional diagnostic equipment. And then in terms of supporting those who are already in development, I mean, what we found, again, from around early March is that these universities, and you've seen what UCT is doing, but UCT and others have really very rapidly repurposed their existing capacity, expertise, and redirected it to COVID. So we already found that by the beginning of March, they were developing their own reagents. They were starting to develop COVID PCR and serological tests. So what we try to do in terms of providing support as MRC is to convene discussion groups. So we try to align all of these activities by bringing together the innovators and manufacturers, facilitating access to samples so that they could get their products optimized and validated, and set up new collaborations. And then also facilitating discussions with the regulators. So we've had a number of discussions with SAPRA, and we facilitated their interactions with the developers to make sure that they are working together and align in terms of what they need to do to register these new products that are coming through. So just very briefly, the Diagnostics Core, I'm not going to go into the details, but to show that from the date of release of the RFA in the middle of May, yesterday, so almost just a month after that, we had our last panel review meeting, and we are hoping to approve projects by next week. So probably a maximum of 6 weeks between sending out the RFA, letting people respond, and actually getting projects approved and funded. And this is really because this is an absolutely dire need. We need to get these reagents out there as soon as possible. On the surge testing, this is an initiative that we are doing with the NHLS. And this is, it started off looking at doing a landscape analysis and a substantial lab readiness assessment that was conducted by NHLS and WITS to see what academic laboratories out there have capability in PCR and have the equipment to be able to take on the spillover tests coming from NHLS. So where NHLS is not able to complete all the testing requirements, these now will go to some of these laboratories which have been verified by the NHLS. So we've engaged with them to get them ready, and we have received a grant from the Solidarity Fund for 88 million Rand to roll this out. We're currently signing those contracts now, and in fact testing has already started. So as a result of this, we both are able to probably in the next 3 to 6 months offer an additional 150,000 tests to NHLS, but also we are capacitating a number of the HDIs to come on board as well. So whether it's equipment, training, processes, and so on, we're working with NHLS and these universities so they can also come on board and offer this surge testing. And then in terms of coordination and convening role, I've mentioned that we've been driving a number of discussion groups on the diagnostic side. We've also been driving or involved in discussion groups on the treatment trials, vaccine trials, and setting up local manufacture for vaccines. We've also had and facilitated a number of direct engagements with international partners. This might be through embassies, through our BRICS collaborations, or through existing partnerships like our Healthy Life Trajectories Initiative partnership with Canada, China, and India. We have a number of discussions ongoing about vaccines and getting trials done in South Africa on these, and additional discussions on other potential research collaborations. So for example, there's a meeting tomorrow with BRICS countries on diagnostics and looking at how we can collaborate with other countries in the BRICS network. And then just to mention, we have now set up a research and innovation repository for COVID. This is together with the Innovation Bridge, which is an initiative between the DSI, NIPMO, and the CSIR. So the Innovation Bridge already exists, and what they've done now is to set up a specific site within Innovation Bridge focused on COVID. So it has 3 separate areas. One is looking at innovation challenges. So there you'll get information on what funding opportunities are available. We have one on innovations, and if you look at the page there, you'll see the UCT Visor, which was mentioned in the previous presentation. And then we also have a tab for research projects. So we encourage everybody to go and self-register their innovations and research projects on there so that we get a nice comprehensive repository of what's happening in the country. Just a very quick overview of some of the vaccine discussions we're having with international partners to bring those vaccines to South Africa for trialing. And then just an overview of some of the highlight areas that we are focusing on in treatment, diagnostics, surveillance, vaccines, understanding the disease, and health systems. So we really are involved in a very broad spectrum of research funding, discussions, and innovation facilitation where we can. So just to conclude then, I mean, what we've been overwhelmed with is the incredible response off their own bat from local researchers, developers who have really just gone about repurposing existing expertise, funding research programs towards COVID, repurposing existing facilities within, for example, medical device manufacturers and diagnostics manufacturers, and also rapidly responding to new funding opportunities, both global and national funding opportunities. And what these initiatives have really demonstrated to us, and I think to the rest of South Africa, is the vast capacity and expertise we have in the country to address local priorities, but within a global context. This COVID-19 has also presented us with some real opportunities to localize development and manufacture. And just 2 examples are on the medical devices and vaccines, and obviously diagnostics side. And I'm happy to go into those in more detail if anybody's interested. And then Just a final point, this epidemic, the local context and the requirements are changing rapidly. So we really do need to be agile, and we've tried to do that with the structures that we've set up, with the working groups that we have. But really, it's a very dynamic environment. If you look at the number of publications that have come out in the last few months that are being published before even peer review, so this whole area is moving very fast, and we need to adapt to that as a funder and as researchers. Thank you.
Thank you very much, Dr. Mulder. That was an excellent presentation. So we already have a few questions to you. So, but maybe let me start by asking the point that you raised in your last slide about repurposing existing expertise. And I agree with you. We have seen a tremendous increase in the number of people from non-medical background coming on to the innovation space and trying to assist with the innovation in a larger sense, because we I work with a group from defense industry, aerospace industry, who are coming to do ventilator design. This is excellent to see. Is it the question is can this be sustained over a longer period of time? Do you think that the priorities are changing, and how do you foresee this being sustainable over the next decade or so? Or would this be like a short-term response which will fall off after COVID-19?
Thanks, Sudesh. That's a very good question, and I think none of us can really foresee what's going to happen. There's a point at which we have to get back to business as usual and go back to our previous priorities. But I think, as I mentioned, it's an opportunity that we have to really put effort into localizing so that we are geared up for this in future. This is not going to be the last epidemic. And we need to make sure that whatever we set up now gears us up towards responding to future epidemics. I mean, that's one thing on the medical devices side. And those medical devices, let's face it, have application beyond COVID. And so none of this is wasted. But I think there's an opportunity now to set that up so that we are ready to respond in the future, and to bring that expertise here, to localize it, to set up the manufacture, which then can be applied in other areas. I hope that answers your question.
It does, and I think it kind of fills in all the gaps with existing infrastructure around medical device manufacturing, for instance. But this actually provides a platform. If you're available, I would like to also take another question from one of the attendees who's asking if MRC, working with the global research priorities of WHO, does this include development of clinical guidelines for managing comorbidities around COVID-19, HIV, and TB? And because that's very relevant to the African context, so is MRC involved in any such research?
Thanks. As far as I'm aware, I'm not aware of any specific projects, but I very much doubt if the MRC and some of our researchers are not involved in that. Many of our researchers sit on the expert panels of WHO and other international panels. So I would imagine they are extremely involved in that. Okay. But unfortunately, I don't have the specific information on hand.
Not a problem. One last question to you, Dr. Mulder, from Janine from Stellenbosch University, who's inquiring about whether these fundings are just for South Africa, or is it can people from rest of Africa also apply to these funding?
At the moment, the MRC funding that we have released is we are only investing in South Africa. Most of the MRC funding does go specifically to South Africa. There are a few grant programs that we have that are available with collaboration. So we would fund a South African partner, and our funding partner would fund those from other countries, collaborators. As I mentioned, we've freed up around 80 million Rand, but this is largely committed already. We have a substantial demand for research and innovation funding on COVID. And as I say, the response has been absolutely overwhelming. So we have certainly enough to fund at this point. We continue to try to release and raise more funding. And as soon as we have any information available or any additional funding available for more grant programs, we will make everybody aware of those. If you keep looking at our website under funding opportunities, And also we have a specific COVID page on the front page, on our, the front homepage of our website, that'll give you more information on what we're doing. But at the moment, it is only open to, or we've only been funding specifically South African projects.
Thank you very much, Dr. Mulder. I see a lot of questions around funding. That kind of segues into our next speaker, Professor Bukhari, who's going to talk about funding and career opportunities for young investigators in Africa. Professor Moses, do you want to take the floor?
Yes, so let me see if I can do that now.
All good?
So all good?
Yep.
Good. Well, thank you very much. So first of all, I would like to thank the South Africa Young Academy of Sciences for inviting me to participate in this meeting. But before I go on, I would like to thank very much Salami and Michele for such brilliant presentations about innovations and sort of like what achievements have been made by scientists in South Africa. Now, so I'll build on that moving forward to talk about the evolution of skills in tackling scientific questions around public health emergencies, moving from what the situation was when West Africa was experiencing the Ebola outbreak in 2014, and what has changed since that time, when you had more countries like South Africa with advanced skills and capacities to address public health emergencies. And then I'll also talk about the opportunities that are there. So we had Michele talking about so much money coming from the South African Medical Research Council to support all the ideas that have been outlined by the two previous speakers. So in comparison, the European developing countries clinical trials partnership, I mean, we provide just to South Africa annually over 400 million rand, and to sub-Saharan Africa generally about 2 trillion rand in terms of supporting. This is just an annual basis. I'm talking here of over 100 million euros a year to support research, mainly for people at the beginning of their career or mid-career. So I just want to remind us what the situation was in 2014 when Ebola affected countries in West Africa. So the situation was different than it is now, because now with COVID-19, we have all countries almost in the world affected. And in Africa, we have very strong countries in terms of technological capacities. But when the Ebola hit West Africa in 2014, Sierra Leone, Guinea, and Liberia had very limited capacities. I mean, in Sierra Leone, for instance, there was not even a national lab with a functional PCR diagnostic facility. So that is how serious the situation was in terms of capacities in those countries. So what happened then was that you had a lot of people from outside leading the sort of discussions and leading innovative ideas. So it's not like here now, we're seeing Salome and Michele almost talking about how South African scientists, South African investment is leading the questions, posing the questions, and guiding how we move forward based on the experiences of the country. Now, when the Ebola outbreak hit West Africa, it was more about people from the global north coming into the region, which had very limited capacity, guiding the research, driving the research, and publishing the outcomes in well-established journals like Science. So what has changed since then, since 2014, and now in 2020, with stronger countries like South Africa, Uganda, Nigeria involved. Now, to actually be able to put this into perspective, let's look at what happened in Nigeria. Because Nigeria was the first country that actually was able to sequence the genome for this COVID-19 virus. So if we look at, so February 27, they confirmed the case using diagnostic facilities. But by the 1st of March, like in 2 days later, a specimen was sent for analysis and sequencing, and in 4 days, the genome sequencing was complete. Now, to put this into perspective, when this virus hit China, it took about 2 weeks before the world knew. And from the time they started analyzing the sample, it took more than 2 weeks for the world to know about what happened to the sequence, what the sequencing information was, and which they shared. Now, when the virus arrived in Nigeria, only Nigerian scientists were involved in processing the sample. And it was mainly young scientists who were doing that. And they completed anything in 4 days. And before they rushed into publishing in Science or Nature, they immediately shared everything. So we had a complete demonstration of South-South collaboration between national institutions, young investigators involved, and it happened very fast, and the data was shared. Now, so, I mean, one of the leading people really that is a young leader now in Nigeria, Christian Happy, who is the director of the African Center of Excellence for Genomics of Infectious Diseases. Now, and this is what he said, after his lab did that in 2 weeks. And you have to, so I'll come back later when I talk about how other countries followed on. But what he wants is that the genome sequencing to be more accessible to Africans, so that Africans can be in the driving seat. We don't want to go back to the situation in West Africa when people, scientists from the global north, were in the driving seat. And obviously, so I'm very pleased today to see from the presentations from Salome and Michele that in South Africa here, we are actually seeing South Africans being in the driving seat, and the South African government putting a lot of funding in ensuring that the research is informed by the activities in South Africa. Now, so if we look again about the countries that have actually successfully sequenced the virus since it arrived in Africa, most of them have been from West Africa, Nigeria, Senegal, the Gambia, and Ghana. I think because they were very much informed by what happened during the Ebola crisis, so they had gone on to enhance capacities in order so that when you have this situation happening again, you don't have to be in a, you don't have to go to other people from outside your country to come and do it. But then after that, of course, so other countries like Uganda, South Africa, Egypt, and Tunisia, they actually got strong capacities compared to countries in West Africa. So they went along to do that. But you have to see that in order to, again, demonstrate the speed and capacity in Nigeria, I mean, other countries outside Nigeria, even though they had the virus arriving in their country about the same time during the same week, but it took about a month after the Nigerian genome sequence was made public for any other country to do the same. But again, we all know that in South Africa, the genome sequencing that was published in April was actually also efforts by South African institutions, leadership from South African institutions. So we've really moved a long way since that time. So what has changed since that happened? Now, so in 2017, the Africa Center for Disease Control was established within the African Union framework in Addis Ababa. And we all know now that the Africa Center for Disease Control and Prevention is the voice managing the coordination of efforts by African institutions and African countries in trying to curtail this disease. And how did Africa CDC establish that? So Africa CDC, immediately they got established, they've been organizing international conferences on the reimagining infectious diseases. In fact, one was planned for 2020 in March. And the photograph on the slide there is the one that happened in 2019. So I participated in the meeting there. And on the panel with me there was actually Professor Gao, the CDC China director. Now you all know about how important he has been in terms of what happened in China. So he has been the leading scientist informing the rest of the world about what has happened. But what I'm trying to establish here, we had a platform in Addis Ababa in order to share not only with the director of the China CDC, but also the director of the European CDC and other people from the United States CDC and Nigerian CDC. So since Ebola, we've actually been able to have platforms where we can have these discussions with some of the most important informed people about how to handle public health emergencies. And that also accelerated a lot of training for young researchers, so that when the situation occurs again, as it did, you can have local researchers like, again, highlighted by Salami and Michele, as it happened in South Africa. And then we had a lot of commitment from the European Union to support research into this in sub-Saharan Africa. So from our institution, the European and Developing Countries Clinical Trials Partnership, soon after we experienced the Ebola outbreak in West Africa, we were committed to putting aside about at least 2 million euros, but up to 10 million euros a year to address this if it happens. So, and also we've been supporting other institutions through our funding to be able to make sure that things have happened. But then, since then, I mean, we also know that, for instance, a lot of genome centers, including the Genome Center that's been established recently by the South African Medical Research Council, again, to ensure that there's a lot of capacity building in the technologies that are related to that. So what happened? So we made a call as soon as the outbreak occurred in West Africa. So the EDCP had a funding. So that's closed now. The call was opened on the 3rd of April, closed on the 17th. But because we had to speed the application processing, but this call was actually a joint call with the South African Department of Science and Innovation. And they made a commitment that if South African scientists were successful to get funding from EDCP through this call, then the South African government, through the Department of Science and Innovation, will actually put additional funding to do that. And I have to say, although the information is not public yet to a lot of people, but those that were successful have been informed that South Africa was very competitive for this particular grant. And so far, we've committed about 10 million euros to support that. Initially, we budgeted 4.75 million for that, but because there are so many applications, we looked for more funds, and they were able to get at least 10 million to support 20, a good number of South African applications were successful for that. But outside that, every year, we also provide funding for capacity development. So if you've just finished a PhD and you want to pursue your studies beyond that, you can apply for funding as somebody who's just finished PhD, not more than 5 years before you apply. But if you've advanced into mid-career, 5 years after a PhD, you can apply for what's called the senior fellowship. And what's nice about the senior fellowship that we fund for about 500,000 rand a year is also we've created opportunities within that so that people who are not yet PhD level can get training, so that the senior fellows that are successful in getting senior fellowship from EDCTP can actually put into their proposal training of students that can acquire PhDs, and then they will be qualified, they will be able to apply for other funding from us. So again, so this is you can get all this information from our EDCTP website, which is the edctp.org. And again, I've spoken about fellowships for career development. But another thing we've done in collaboration with Africa CDC, I think that was probably in my last slide, no, not this, is to work with Africa CDC in order to increase the number of field epidemiologists that can participate in this kind of activities. And that call is open, and we'll be providing funding for local institutions to train epidemiologists. And just so this, I've been so sort of like impressed recently for how things have changed from when Africa, West Africa especially, was affected by Ebola, and what has happened since then, and how much capacity has been built. That I actually wrote a little story in the conversation to demonstrate how this has happened, and that is in the conversation, which you can read, which is really a summary of what I have been talking about. Thank you very much, and I'll be happy to answer your questions.
Thank you very much, Prof. Moses. It's kind of nice to see the wide variety of innovations that you covered. Right from the genomic sequence to all the support structures that EDCTP has made in place. So, would it be can you possibly give us some highlights for young scientists, especially members of SAYAS and the other Young Academy members, on resources that we could look up to, especially coming from the EDCTP, in terms of whom to contact and how do we proceed in terms of getting funded for some of our research? Because there'll be a lot of attendees here who might be interested in that, not just for COVID, but beyond COVID.
Right, okay, so yes, I'll provide that. So what has happened, because South Africa Department of Science and Innovation wants to really see that South Africans can take advantage of these opportunities, they have supported a project coordinator position so there is a project coordinator based in the South Africa Medical Research Council, and her role is really to provide this. So I'll be able to provide the contact details for that. But if you go on our website, you'll get all that information. And of course, our office, the Africa office for EDCTP, is based in the Cape Town office, Tygerberg, of the South Africa Medical Research Council. So we are easy to locate. And if you don't have my contacts, or Michelle can also provide contacts for our office, and we'll be able to tell you how you can get in touch with us, or through the Department of Science and Innovation, how you can access these opportunities that are available from EDCTP.
That's fantastic. Thank you, Professor Moses. I have a question from the attendees. So is the capacity development funding for academic programs such as Masters and PhD, or does it also cover non-academic programs?
So what we do, so it also, this is just for career development. So for non-academic programs, the problem we are facing now, for instance, with this current pandemic, is that we need to go through whatever, so some of the solidarity trials and most of the other innovative ideas that were being put forward before, these have got to go through ethics committees and have got to be reviewed by regulatory authorities. So what we do is that we actually provide funding to support national ethics committees and national ethics regulatory authorities. So if there are, if for instance, you have a national ethics regulatory authority. I mean, we provide up to about 300,000 euros for that. And so you can actually put into that application, I mean, training social scientists in order to be able to perform better within the ethics committees, or other issues apart from even trying to move from paper-based application processing to electronic application processing. So we do a lot of things, not only funding scientists, but also ensuring that capacities in a lot of governments are strong enough to be able to review applications that come through when you have a crisis like this.
So that's a very interesting contact, and we definitely would be sharing your contact details with the attendees, and most of them would be able to contact you directly or through your office. So my last question to you, Prof. Moses, is about fast tracking clinical trials approval. Is that is that been the case with COVID-19, or clinical trials is quite a broad topic, but for especially fast tracking SAPRA approval for medical devices, or SAPRA approval for medicine treatment protocols, how is your office dealing with this?
Well, so we don't deal with that specifically. But what we do, for instance, we've been working with WHO Afro to review protocols for clinical trials regarding the Madagascar product, COVID, what is it? Okay, the COVID product. So we do things like that. So, but we are not, at the moment, our role is mainly about funding, but we also support people who are well established in the field to input into that. And as I said, we're working with WHO and other partners to ensure that the protocols that have been proposed for clinical trials regarding the COVID organics, yes, that's the name of the product from Madagascar. I mean, how suitable is it? How can you ensure that it is reviewed scientifically? So we provide that kind of support.
Thank you very much, Prof. Moses. I would now move on to the last speaker of the day, Dr. Alisa Glazer, who's from the African Institute of Human Sciences Research Council. Dr. Glazer, do you want to take over the presentation, please?
I'm just trying to make this go.
Sure.
Is it shared on your side?
Not yet.
Not yet.
Well, let me make sure that
Is it shared?
Yes, it is.
Okay. Okay, great. Well, thanks to the colleagues who have already spoken on the innovations that have happened in either being led by the respective institutions or that have emanated from certain countries, which is of importance for us in the Africa Institute. So my name is Alisa Glazer, as I've introduced myself earlier on. So my talk really is to just talk a little bit on what other colleagues have mentioned, and also to take us to a point where we need to understand what it really means for the continent. So basically, if I may just introduce what Human Sciences Research Council is and what AISA is. So AISA, which is an African Institute of South Africa, which was incorporated into the HSRC by 2014. It is a knowledge hub, which is research driven for both human and social research and developments in South Africa and the continent wide. So majority of our research really, it's about African societies, the development, and sensitizing ourselves and their societies to an innovative generations of Africa, or increasing or really trying to advocate for an innovation-led African societies. So our mandate really is it's majorly to produce knowledge and share it with capacity building for a better Africa eventually. So which we do through the pillars that consider knowledge production, as I've mentioned it, training and capacity building. We have various conferences and training opportunities that we convene or conduct as the institute. And also we are very much involved in policy development and advice, convening, like we have also convened through this Zoom meeting, as well as the public engagement and the networking. So basically much more like our other sister councils that have presented before. So really, we do conduct basic and applied research, and as I've mentioned, the trainings and the guidelines. I think one of the strong points that ISA has built reputation in, it's the science and science, technology and innovation policy shaping, as well as the peace and security advisory roles. So we do have various partners that we work with, including the Department of Science and Innovation, as it has hosted us now as well, and many more others, and DERCO as well as some of the partners that we work with. So I think earlier on, colleagues did mention what they think of what health innovation is. And of course, it does cover a wide variety of things, which may vary from scientific, medical, economic, and social issues as well. And I think with the COVID, we've managed to see so many innovations, although they may have initially been thought of not as belonging to the health innovation, but most of them were talking to really supporting the health innovation. And by that, I mean like even some banks or some finance institutions trying to reduce handling of cash, for instance. So we've seen such innovations that were coming from a variety of institutions trying to support the pandemic, trying to reduce the scourge of the pandemic of COVID. And I mean, really, within the South Africa's national system of health innovation, we do have, as colleagues mentioned, development of new drugs, the vaccine, diagnostics, as colleagues also have mentioned some of the diagnostics they are talking, they've been working on, development of medical devices, and so on. So also part of that system is the indigenous knowledge or innovations. I mean, they've been so crucial, and I think the Madagascan case has helped us to remember that indigenous knowledge or innovations are also part of the innovation system, you know, because oftentimes we think of the health innovations within the context of drugs and vaccines that may not be coming from the herbs or the indigenous products. So really, the SARS-CoV-2, which is called COVID-19, really comes at a time when we have been battling with the burdened health systems, you know, due to the communicable and non-communicable diseases that have been present in the continent and in our country. And I think the preliminary results from the Western Cape that showed us how people who live with comorbidities are likely to be negatively affected or heavily affected by the COVID-19 have shown us just that burden. But also, I think it has made us to really want to wake up to wanting to collaborate a lot and want to avail more resources that can assist the continent and in South Africa to cope a lot better with the COVID pandemic. So really, in short, the SA bioeconomy strategy, if I may just highlight a little bit on it, does entail all the components that colleagues have mentioned as far as medical devices are involved, the trials that need to be run for the vaccine testing or the drug development, and accessing the markets or monitoring, and the capacities that have been built. I think Moses has managed to highlight to us just how much of capacity we have within South Africa as well as in the continent to make sure that we can respond to such pandemics. I think also Moses, you may and other colleagues may be aware of the coalition that was launched to really fast track this clinical research and development in response to the COVID. And it included Ethiopia, Ghana, South Africa, and Tanzania, which is very important because one of the things that we struggle with within the continent, it's really this collaboration when it comes to health challenges. We can mention just when we had the cyclone Idai, for instance, it was very difficult to respond to that, and it ended up really having to be attended by fewer agencies or African countries. But then Mozambique, which was mostly affected, it was very difficult for it to respond to the the impact of that of the cyclone Idai, because eventually, as they ended up having the I forgot the name of that disease, I remember it, but then as they ended up having that the diarrhea disease, it was a challenge, and then also the infrastructure that had dilapidated as well posed a challenge for the country to recover. So what I'm trying to say really is that COVID-19, it is ushering us into that era where we see African countries having no option but to collaborate, where we see ourselves having to harness as much capacity from the sciences and other faculties to make sure that we can collaborate and come up with solutions that can make sure that we do not feel the impact deeply. And to that effect, I also want to say that I think some instruments such as the strategies within the continent, they assist us a great deal. And I'll just like to highlight on STISA, which really the Science, Technology and Innovation a strategy for the continent. I mean, like, its priorities really have to do, as I've mentioned there below, the priority areas do include prevention and control of disease, which if had we not been building on developing the capacity, it would have really taken the STISA back, because then this pandemic comes to test really how far we have invested or how we have been working to action these strategies. And I think some of the examples that come from colleagues from their earlier on presentations do highlight that at least at some continental level, there is a mobility to make sure that these strategies are driven. And I've also highlighted the wealth creation there, because wealth creation, as probably some may think of it as a wealth in terms of monetary, but then it's not only wealth monetarily, but it's wealth in terms of the capacity. So the scientists that are able to respond to the challenges that the continent may experience are part of that wealth creation. So I don't also want to go to town with this, but I think colleagues did mention some of the innovations that they've put in place in the local hospitals. And also earlier on, we have seen that some startup companies or universities that came to respond to the pandemic in various countries. Zimbabwe, for instance, developing a ventilator, and also the Madagascar that came up with that COVID herbal boost, immune booster. And I mean, like, there's been a debate much to do with that. And I think I would like to appreciate the South African government in really stepping in to say they will assist Madagascar to try and test this, the booster, and validate what they've been claiming as far as its effect is to combat the COVID symptoms. So, and also the Senegal Louis Pasteur Institute that has been working on the rapid test kit. And also, I mean, like, they do produce some of the vaccines in the continent. So really, I'm just mentioning these as a highlight to say that, look, we do have the capacity to develop health innovations within the continent. And I think this is highlighting to us that as much as we do have health systems that may be ailing, or we may be having a shortage of certain human capacity, skills that is much needed for this kind of pandemic, but we do have some know-how and some capability to combat it. And Also, I think this crisis really should be taken as an advantage to assist us with developing our economies. I do see it as something that will create, that will respond not only to curbing the effect of the COVID or the health impacts on human subjects, but also something that is likely to create employment. I mean, we do know that as the continent, we do suffer from high levels of unemployment, dwindling economies that are always being revised. But I do think that with the certain innovations that have come out of the various countries within the continent, these should be enough to bolster our economies. And I think in bolstering those economies, we need to take, as scientists as well, we need to take advantage of the African free trade agreement, and make sure that we can make use of science as a tool for trading, or that we can trade with. So as this is just an image that I got from McKinsey that shows what is likely to decline. So as you can see that there's an expected decline in the next normal, which is expected to be about 86%, and this is in relation to patient contact, direct patient contact. So as Salome mentioned, some of the telemedicines examples, or the USSDs, so how one can get information and so on. Those are some of the innovations that are likely to be on the rise. But as much as that, as much as those are going to be on the rise, these need to really we need to find means to not only see them as innovations that will end up being absorbed a lot by technologies, but then also how can we move our societies to participate in these innovations and create them as well. So I'm just highlighting that these as well to say, look, some of the challenges that we faced, we need to look at them in relation to our context. That, for instance, perhaps an in-home nurse visit may not be something that is feasible to all of us, simply maybe because of factors like crime, and also we probably don't have enough nurses that can do all those home visits. So, in short, I just want to say that when we do come up with this research development and innovation strategies or interventions, they need to take into account the local context of our societies. I just brought in this Eastern Cape recent ambulance issue because I had noticed that it had become something that was mockable on the social media, which I found unnecessary, because really those are some of the interventions. I understand that there were some connotations surrounding that and some doubts around whether there's possible corruption and so on. But besides the matter, those are some of the interventions and innovations that we need to consider as far as our realities are concerned. So we need to innovate with that in mind, that we do not have perfect communities, we do not have perfect societies. We have challenges that speak to crime, and we need to take that in mind when we come up with innovations. Because one of the things that that gets us stuck, it's not innovating in that context of understanding the challenges that we are faced with immediately, and we come across as elite. And I think also, I just want to say, you know, our research a lot of time relies on government, and I think it's about time that also we need to invite the financial institutions to start seeing their role, the role that they can play in making sure that they can be they can advance the health and biomedical research within the research and development and innovation space. So we need to have some sort of a feeding scheme also as well, in terms of how can we better organize the research, development and innovation to feed into development and adoption framework. So most of the innovations that happen in the continent, and particularly when they're coming from the small medium enterprise folks, is that you find that it takes time for them to be absorbed into the national systems. we need to, as researchers as well, take that into consideration and make sure that they can feed into our national development agendas. And also what we are trying to look at as AISA, one of the studies that we will be conducting in the near future, will be trying to look into the influence factors of innovation adoption in the continent and sort of develop some innovation index and use science diplomacy as well to drive these innovations into a larger context. Because we are very much supporters of continental frameworks for development. We also want to see how we can make sure that they do not only end up being absorbed by prestige institutions like ourselves as councils, MRCs, and so on, but then how can we also diffuse them back into communities so that it is not only, they are not only being useful to us as the researchers sitting in the councils or research institutions. So thank you.
Thank you very much, Dr. Palesa. That was an excellent presentation. I have a question around the coalition that you mentioned in your presentation. You know, of the 54 African countries, we see that only about 5 countries are part of this coalition. And is there, from your opinion, is there a specific reason why we haven't been able to get more people onto collaborations for a pandemic like COVID-19? Is this a typical scenario, or does what do you think are the limitations when it comes to a larger coalition within Africa?
I think one of the things that we had found out was that, you know, investing in research and development, particularly where there is health and sciences concerned, there's not much of an appetite. I think the continent for a very long time, they have seen this as something that belongs a lot with the international community. And by international community, I mean the European. Moses, I'm sure, can attest that most of the funding that we get for conducting some of these researches, it's coming from Europe or the Americas. So that those are some of the prestige means of funding that we are likely to attract or want to play a role in. So I think, well, I'm hoping, not that I think, I'm hoping that with this COVID, some of the countries, as they start realizing the impact it will have on its societies, they will start increasing their contribution towards research and development. I mean, if you look, I don't think we even have 10 countries that contribute almost 1% of the GDP, as it has been agreed that it's a goal that we need to strive for as African countries. So those are some of the challenges that we find that collaboration will be taken by some of the few countries that do have these facilities or the interest for conducting research.
Thank you very much, Dr. Palesa. That kind of leads into the final section of the webinar. So here we're going to have a question to the entire panel, and we've got less than 5 minutes. So, you know, if you can be brief, that will be really hugely appreciated. And after that, you know, we would go around with a, you know, brief summary of your conclusion remarks, and then with that we'll conclude the webinar. So the question to the panel, there are 2 questions, but I think both of them can be put together. So in terms of you know, synergies and promoting intercontinental collaboration, especially in the e-health platform, or even in the larger sense of global health, and specifically around COVID-19 or even beyond COVID-19, are they you know, what do you think would be the strategy? Is there a need? Is there a possibility of creating an interoperable platform? You know, where is something around the e-health system? You know, where something that is developed in South Africa is operable in Nigeria, and so is operable in Ethiopia, etc., etc. Can we have a Pan-African platform? Or, you know, what do you think would make the African solutions relevant to all African countries? So the question is to the entire panel. Whoever is willing to answer can go.
Well, if I can come in there quickly. So the other thing that we fund, EDCP, apart from individual career development funding, is regional networks of excellence. So South Africa, for instance, is part of the Southern Africa Regional Network of Excellence, and they do a lot of things. So we do, and we are providing up to, for the next call, we're providing about 5 million euros for those. So for those regional networks of excellence, you can, not only the region, but you can have the Southern region collaborating with the Central African region, for instance. So there are opportunities out there. I mean, it's a lot about collaborations now, and people are funding collaborative grants, consortia grants, so that funders are looking into that, and those are things we will support.
Thank you, Moses.
Yeah, so some of the things that we do as IES, I mean, like really our mandate is Africa. So some of the things that we do to lubricate that is first and foremost just conduct our research within the continent, and do go to the other countries to make sure that we can develop stakeholder interest, and also find out what the country strategies are, or what the ministries of different countries are working on, or how they can be supported. So as IESA we also try to sensitize the young Africans to playing in the research areas that will make sure that eventually drive that collaboration within the continent. We do this via really the science diplomacy. We do it via the conferences that we hold as well, but also we are willing to collaborate with other stakeholders or institutions that think that they need support in terms of making sure that their research is being absorbed. For example, if MRC is able to work on some vaccine, I'm just making example, colleagues, to work on some vaccine. So we are able to work with MRC to say, look, how do we make sure that we can take this information in collaboration with MRC and make sure that we can disseminate it within the continent. And in that way, we are able to create a feedback loophole into South Africa as well, of researchers that may be of interest. And also, eventually, we find that most of the young scholars or researchers that we've worked with, also when we put them onto some multidisciplinary trainings of some sort that we do with Kenya and Nigeria, they are able to start developing proposals that can take into consideration collaborations and multidisciplinary shape. Yes.
Thank you. Salami and Michele, do you want to respond to that?
Yeah, just from my side, I mean, COVID has certainly forced us to do things differently, and I've seen a rise in South-South partnerships, as Moses was saying, and we are, well, the field I'm in, global surgery, forces, us to work across the continent. And so we working towards sharing these ideas and working together. But COVID, by closing down the borders and everything, has forced us to find African solutions. So we are working at seeing how these innovations how we can share them and design new things across partners in other parts of Africa.
Thank you, Salami. Michele?
So thanks. I mean, we have a number of bilateral programs and multinational programs with different countries. I mentioned just the BRICS network. And this is an idea, in fact, that came from Russia, is to look at how we can set up research and academic networks on particular aspects of COVID between those different countries involved in BRICS. And I mentioned tomorrow is the first discussion on diagnostics. So we've collated a panel of around 8 to 10 researchers in South Africa who we know are very involved in this, to be involved in that discussion. And we're very open to similar discussions with other African countries. So we do already collaborate quite substantially with the African Academy of Sciences based in Nairobi. In fact, we run joint calls with them on the Grand Challenges program. So, you know, we're very open to playing that convening and coordinating role as the MRC to set up those collaborations, to facilitate the discussions and to explore opportunities for collaboration, both in research, but also in getting new innovations out there and scaling them in Africa. We do have a partnership with PATH, based in the US, who also have a number of country offices in Africa, and we're already working with them on scaling innovations in Africa, but not COVID related. This is prior to COVID, but we could use those same networks to scale innovations in Africa. So we're very open to any ideas or any interest that there may be in collaborating, and we're happy to play that convening role.
Thank you very much, Michelle. So we are in the final couple of minutes of the webinar. So I'm going to go around the speakers to request for closing remarks. So we can go in the same order of the presentation. Professor Salami Msimang.
Yeah, so simply from my side, it's, you know, it's a time for us to find African solutions to the challenges that we have in Africa. And this forces us to work together, to work hard and be creative in finding new solutions and new innovations led by us as Africans.
Thank you, Professor Salami. Dr. Michele Mulder.
Well, firstly, thank you very much for the invite and to be a part of this panel. It's a real honor for us and for myself to represent the MRC. I could actually talk for 2 hours on what we're doing in the health innovation space, but if there is more that we can be doing, we, again, would be very open to hearing about it. We do feel that we have a role to play nationally in supporting the COVID response on the research and innovation side and beyond our borders. And, you know, whether that's as a funder, a conductor of research, or a convening role, we are open to any suggestions.
Thank you very much, Dr. Mulder. Professor Mrs. Bukhari.
I'm enormously encouraged by what has been demonstrated here, that Africa can now do things their own way, that we've got the capacity driven by our young scientists to tackle our own situations without too much reliance on the global north.
Thank you very much, Prof. Bukhari. Dr. Alisa Glazer.
Thank you very much for also having me. I think it was a very rich platform. And I think above all, I'm quite excited by the fact that, you know, oftentimes we feel so despondent that we cannot respond. And I think from the presentations, from the panel, the quality of panel and the influence they have within their institutes and institutions and the country, it's you know, it's far reaching. So I'm quite encouraged by that. And I also look forward to working with you colleagues. And I hope also the panelists do not feel afraid to get in touch with us so that we can also widen this collaboration that we're trying to achieve as researchers and as a continent. Thank you very much.
Thank you very much, Dr. Alisa. It's a real honor moderating this session with the panel of such a top-level expertise. And just for the attendees, the contact details of the panelists have been shared on the chat section. And if you need more information, you can contact us anytime. And Edith or myself will be more than happy to share the details after the webinar. And the recordings of this particular webinar would be made available, and you can follow on our SAYAS or ASF websites to get more information on when the recordings are available for the larger public. And with that, I would like to take this opportunity to thank SAYAS and ASF for organizing this webinar, and more importantly, our speakers, our panelists, for giving such a rich context and information around health innovations for COVID-19. Before we conclude, Edith, do you want to add anything to this, please?
No, just to echo yourself, Sudesh, in thanking our esteemed panelists, giving us their time to share with us the knowledge of what they're doing in their respective fields, but also as a contingent as well, and to encourage us all to continue contributing, but also sharing the knowledge. I think it's important that we enable others to know what we are doing and sharing the different facets of all our respective journeys. Thank you once again, and we really appreciate it.
All right. Thank you very much, Edith. And thanks once again to all the panelists. With this, the webinar is now formally closed. Thank you.
Thank you.